Hello, Suzanne Conzi with Dawning Visions Hypnosis, here to ask you a very simple yet truly important question. Do you feel safe telling your supervisor the things that you need to tell them, both about where you are if you're having a difficult time that you're going through, or in terms of what's going on with your patients? This is one of the reasons that one of the therapists who had a video on YouTube left his employment. And I can tell you that I have had several occasions when I was treated less than humanely by the directors of some of the programs that I worked in the supportive housing programs, going back to the early 1990s when I first entered the world of mental health. See, the issue was that the directors in my programs didn't understand the support that our clients actually needed and the reason why they were actually in those programs. You'd think that they would know these things, having a master's degree and a license to practice mental health. But the reality of the situation was they did not have a clue what they were doing. And as a result, the clients suffered. One place was so bad that I put in an 8-point letter to the Department of Mental Health in Massachusetts, giving the details of what was going on with 8 different clients in that particular program, because it was that bad for each of those people. Sometimes you just have to take a stand for what's right. And the reality of the situation is, if you cannot trust your supervisor to have your back and to help you learn how to do the things you need to learn how to do, or to work through the things you need to work through, it's not a job worth having, in my estimation. It's not worth the stress. It's not worth hating your work. It's not worth having to worry about what's going to come in your face the next time your supervisor decides to give you some of his or her mind. It's just not worth it. And it's really one of the reasons I left conventional mental health, because I was not willing to harm my clients because of the ignorance of the directors of the program. And sadly, this is something that I found in working with the elderly as well in their homes. The very first place that I worked for was wonderful. It was owned and operated by nurses. They knew what the hell they were doing, and they cared very much for their clientele. And they had my back all the time. I was definitely overeducated for the job that I was doing at the time, but I did learn a whole lot from working with these particular patients. Actually, a lot of wisdom, because when you're dealing with 80 and 90-year-olds, they've seen a whole lot of things in this world. Sadly, in other elderly care programs, it seemed like the money was all that mattered, and that they didn't really give a damn about what was going on with the patients. Because unlike the first place that I worked at, where I was able to know exactly what was going on with the patient, so I would know what I needed to do, these other places, they didn't tell me, even when I asked repeatedly for the information regarding what was going on with the patients, what their physical ailments were, if they had any mental health issues. They didn't come clean with any of this stuff. So how in the hell am I supposed to help this person if I don't know what's going on with them? I can't. So this is a problem. And it's a real problem that we need to assess when we are working for other people. It's also the reason why I decided to go into practice for myself, because I was unwilling to do any harm and to deal with ignorant people who are my bosses. And it may be that in your situation, depending on what your situation is, maybe you're really happy in your placement. And if you are, congratulations. I'm really happy for you that you have a really good place to work for, and that they respect you and they listen to you and they support you, especially in your time of need. But for those of you who are having a more difficult time, you need to think about whether or not you want to move to a different place of work. And actually, that's what this gentleman did for a while. He did move to a different place, but after a while he just decided it was time to leave. He was just burnt out. However, if we really love the work that we're doing, and we love working with our clients and patients, maybe that isn't the right approach. Maybe we need to think about how we can offer our own services. Now, I am a hypnotist and a linguistic programmer. I don't have to have a license, and I never wanted a license because, as far as I'm concerned, there's a lot of rules and regulations that one has to follow that are not necessarily to the benefit of the patient. I don't care what they say, it just isn't true. A lot of those rules and regulations are really there to protect the therapist, not the patient. So I went out on my own. If you'd like to do the same and learn how to integrate hypnotism and neurolinguistic programming into what you're doing, and maybe leave the world of licensed therapy, as one of my trainees actually did. She was a PhD psychologist who was just sick of the medical system and just decided to become a coach, where she could earn $400 and whatever dollars an hour for a 45-minute call and not have to deal with insurance, didn't have to deal with any kind of bosses, and just do her own thing. She's really quite happy, and she's really excellent at what she's doing. Maybe you'd like to do that instead. I don't know. It's an idea for you. In any case, if you're interested in learning how to do hypnotism and neurolinguistic programming, I have a 2-day, yes, it's 2 days, 7 hours a day, online, one-on-one training that I do. I love doing it, with a 12-month mentorship, so that if you have any questions while you're working with your patients or clients, you can message me, we'll set up a video call, and I can tell you exactly in what order you need to do what and help you to do them techniques correctly. My trainees love this program, and I don't know of any other hypnosis or NLP training program that's offering a mentorship. But I can tell you this, that's the way I learned how to do what I do. And that's why my clients no longer have symptoms based on mental health issues that they came in with. They're gone. And that has to do with everybody from drug addicts, who I don't work with anymore, people who have sex addiction, which I do, 4 to 6 weeks, they're done with it, never looking back at it. I work with anorexics so long as they're at a healthy weight. I work with all the mental health issues and boundaries that they need to create for themselves. Bulimics, people with depression, people with anxiety, and people with OCD, and people that have a combination of maybe 1 or 2 of those things going on together. Because as you know, some of these diagnoses do have other things going on. If you'd like to learn how to do this and get the results that I get with my clients, by all means, check out my contact information below, and we can set up a time for a free consultation call to see if that's something you'd like to do. You can do it in a Saturday and a Sunday. That's usually when my trainees do it, because they have jobs, and it is 7 hours a day. So that's all I have for you this time around. As always, I thank you for spending your time with me. Till next time. Bye-bye all.